talking about the integumentary system today, which is otherwise known as your skin, or it can be called the cutaneous membrane. So this is quite a large organ in the body. Your skin is considered an organ. It covers your entire body pretty much. It weighs about 7% of your whole body weight, 7% of its skin. And let's just get right into the outline. You can see actually that this is a remake of a drawing we looked at in chapter 1. This is a person that's holding his skin. So this is one of those Body Worlds exhibits that you can see when we can go back to museums. So the overall functions of skin I have here in the outline, and also added some additional material here to the slide. So this is a very good protective layer. Your skin is resistant to trauma, so all kinds of physical bumps, scrapes, things like that, cuts. Your skin is very tough. It has a very tough keratin. We talked about this, that the top layer of skin is completely keratinized. So keratin is a protein that is packed inside the upper cells of your skin, the epidermis of your skin. And so it makes the skin tough, it makes the skin waterproof, it makes the skin very resistant to chemicals and also to germs trying to come in. So all those layers of the epidermis is a really good barrier. Your skin functions to stop water loss and water gain. So there is a lipid layer a little bit deeper in the skin that can, basically protect your body from losing and gaining water. So if you can go into the ocean, which osmotically speaking should suck all the water out of your body because it's a hypertonic environment, but we don't lose our fluids when we walk into the ocean. It doesn't come out because our skin is waterproof. Your skin helps to block UV radiation. This is another protective mechanism because there's built-in pigment in your skin called melanin that absorbs UV. We'll talk about that. This is your physical blocking chemicals. Your skin, however, is permeable to some things, right? There are items that do cross over through the epidermis to the dermis and can get into your bloodstream. So you have to be careful handling certain materials, especially chemists or people who work in a biology wet lab. You have to be careful with the things that you work with because some of it can go through. And it helps with vitamin D. So, and as well as having a lot of sensory receptors right here. So let's take a look at the outline. I just want to get into the body temperature, the thermoregulation. So thermo refers to temperature, regulating our temperature. There's two ways that your skin does this. One is with the capillary network in the dermis. So notice that this upper layer, this is your epidermis. Our blood supply is not there. Our blood supply is in the dermis. And I want to point out that the capillary network can either constrict or dilate. So vaso refers to your blood vessels. Constrict means to get smaller. So if your blood vessel is normally on an everyday basis a circle like that, the diameter, constriction would be just narrowing the diameter and making it harder for blood to go through. Less blood would run through a vasoconstricted blood vessel. The times where you would want vasoconstriction, because remember, blood is warm, right? Your blood is very warm, is if you want the blood to be conserved, you want to draw the blood away from the surface of your body because you want to conserve that heat to the core of your body. So this would be, vasoconstriction would happen when you're feeling cold. Okay, you want to conserve the heat. And all the warm blood is no longer going to be at the surface of your body, but pulled in towards the core, where all your important organs are. Vasodilation is just the opposite, right? So we have a blood vessel that maybe is normally this wide in diameter, and it gets a little bit bigger, so it allows more blood to flow through closer to the surface of the skin, and we can see that we're losing a lot of heat because, again, blood is warm. So when you're feeling hot, right, if you're feeling very hot and warm, then the blood vessels will vasodilate, bringing that extra warmth, heat to the surface of your skin so you can lose it, you can dissipate the heat to the environment. So So that's one way that your skin uses the blood vessel network to help control the temperature of your body. Another way is sweat, of course. So sweat is based on a evaporative cooling. So water, which is your sweat, will heat up with your skin, right? Because your skin is very hot when you're sweaty. It will absorb that heat from your skin, and then the water molecules will leave your skin, taking all that heat with it. So the water beads that are on your skin will absorb and absorb and absorb that heat from your body until it changes phases, right? It's a liquid phase, and then it changes into a gas phase as it evaporates. So that's another way of helping us cool down. Vitamin D is aided by your skin. So your epidermal cells use UV radiation to help create this vitamin. It doesn't make vitamin D right off the bat. It's more complicated than that, but it definitely helps start the chain reaction. So vitamin D, you can see in this diagram that UV light hits your skin. The UV light is going to help catalyze the function of an enzyme. And then this is going to make a pre-vitamin D. So it's not vitamin D yet. It has to go to the liver and then the kidneys to become an active form of vitamin D. But your skin is the first thing in this chain of events, and UV radiation is necessary for this process to happen. So everybody needs a certain amount of sunlight every day. You need some UV radiation. So if you're inside all day, every day, or if you live in a very dark environment, then you are probably better off taking vitamin D supplements. All right, so let's talk about the sensory reception is the last one. So we have a lot of different kinds of sensory receptors in the skin. I will leave that. I'll talk about a couple of those, but we can see that pain and temperature and pressure and touch, they're all part of your skin's nervous system, like the nerve endings of your skin. So let's look at the features, Roman numeral 2 of your skin. So let's take a look at the picture we have here that you're looking at. It's a beautiful picture of your skin. We can see the upper epidermis. So from this pink band up, that is your epidermis. Your epidermis is made of this yellow, they colored it yellow. These are all your dead cells. These are completely dead part of your epidermis, and you'll learn that as your stratum corneum. And then the pink area is living tissue. This is alive, also part of your epidermis, okay? And there's sublayers there we'll talk about. Everything in gray from this point down, this is your dermis. So you can see it's very different looking than your epidermis. Let's review, right? What does your epidermis consist of? What is this tissue? It is stratified squamous, right? Keratinized epithelium. But the dermis, let's review, right? You should know the dermis is connective tissue, and most of it is going to be dense, irregular. But I'm going to add something here. It's not all dense irregular. There's also some areolar. So if you look at your outline under features, the epidermis is listed first, stratified squamous keratinized. It's the upper part of skin. The dermis consists of areolar and dense irregular connective tissue. So I want to have you guys look at this and notice how this very first little section of gray from here down to about here, okay? So I'm going to draw a line that kind of, for me, looks like the sort of intersection between the two different tissue types here. You see how that upper part looks different than all of this other part. So this is your areolar, little tiny areolar layer of connective tissue of the dermis, and then everything from there down here is going to be your dense, irregular connective tissue. I maybe have missed, maybe it's like this. Anyways, so that is the skin. Underneath the skin, there's always going to be fat. There's always going to be a hypodermal layer, also called the subcutaneous layer, but this is not skin. So the organ of skin is just epidermis and dermis. Let's look at the next slide here. So again, cutaneous membrane is the same thing as skin, is the same thing as integument. Okay. The epidermis, we talked about this. The dermis, 2 layers. This is the areolar connective tissue layer. This is called the papillary layer. And then the rest that we talked about, the dense, irregular, this is the reticular layer. So these are the kinds of connective tissue that are found, but the names are called papillary layer and reticular layer of the dermis. All right, we will talk about accessory structures of the skin later in the second half of this lecture. And this is just kind of one of those pictures that's a little bit awe-inspiring. The epidermis, you can see this upper layer, that's what you put lotion on, what you feel and touch every day. The dermis is deep to that, and then deep to that you'll always have the hypodermis. So remember, the hypodermis is not skin. It is always present under the skin, but it's not skin. And then you have your fascia. Fascia is connective tissue that separates organs and structures in your body. You find fascia a lot between skin and muscle, or between 2 muscles. And so a lot of times this word fascia is used in massage therapy, right? So if you are tight, you're feeling tight, or a muscle's kind of very tight, you want to work the fascia, they want to sort of massage and loosen up the connective tissue that binds the muscle, and then thereby giving the muscle more room to be stretched. And then of course we have our muscle. All right. So we're getting into layers now. So I'm going to go through the layers of the epidermis. This is going to take a little bit of time. And we're going to look at each one, and then you're going to have to recognize the different layers of the epidermis on the exam. So one thing I like to use to memorize the layer of the epidermis is in your outline. It's come, let's get sunburned, right? So that's the order. Come, let's get sunburned is the layers corneum, lucidum, granulosum, spinosum, and basal. The way I have your lectures organized is actually working from the bottom up, because the bottom is where the new cells are made. We're going to go ahead and talk about the bottom first and then work our way up. So the bottommost layer, the deepest layer of your epidermis, is called the stratum basal. Basal, or the word basal means bottom. So that's the bottom layer. And this is the layer that's going to attach to the basal lamina. And guess what is right underneath the basal lamina? Connective tissue, right? That's what you learned in chapter 3. This is connective tissue, and this is areolar connective tissue. All right, it contains your stem cells. You knew this already, because anytime you have a stratified epithelium, the bottommost layer contains the regenerative cells, the stem cells. So when your skin regenerates, it regenerates from this layer. Actually, I should say when your epidermis regenerates. It also contains melanocytes and things called Merkle cells. So let's take a look at our slide here. I forgot to mention, let's go back up to Roman numeral 2. There's 2 terms I forgot to mention, the epidermal ridge and dermal papilla. So I'm going to look at this picture. So the epidermal ridge and the dermal papilla are features of the skin that you see in histology slides. The junction between the epidermis and dermis is not a line. It's actually, it goes up and down. So it goes up and down and up and down and up and down like that, right? So this would represent the dermis under here, and this is the epidermis. The upward projections of the dermis, here, 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 those are called dermal papillae, okay? Let's look at a dermal papilla in the histology slide. It's right here, right? So remember the epidermal tissue, anytime you have epidermal cells, they're always going to stain dark compared to connective tissue. So for skin, you're going to look for this very drastic transition from dark to light. So that light area is the dermis. And you can see how this upward projection, we're making a little hill here, that's a dermal papilla, okay? So what is our epidermal ridge? It's the downward projections of the epidermis, right? That's all it is. So why? Why is skin oriented this way? Why isn't the border between the epidermis and dermis just a straight line? And this is, again, surface area. Anytime you see pleating or folding or anything like that, it's to increase surface area. So why does the dermis want to contact the epidermis so much? And this is because of blood supply. Remember that your epidermis does not contain any blood vessels because your epidermal tissue is avascular. This is great because we can just, scrape off some of our epidermis and we won't bleed. However, the cells are starving for blood. They want oxygen, they want nutrients. So the blood supply is found in the dermis, as you can see here with our blue and red representing our blood vessels. The reason why we have this up and down is that we can maximize the surface area, so we can diffuse blood and the nutrients in the blood and the gases through all of this surface area, right? I'm drawing arrows if you can't tell. So you have a lot more surface area for diffusion to occur between the dermis, feeding the epidermal layer. All right, good. So now we can get started with the stratum basal. So let's talk about melanocytes. Melanocytes, let me show you this picture here. Melanocytes are cells that are found predominantly in the stratum basal, okay, in the stratum basal, the last layer. They can be found a little bit higher up, but most of them are in this last layer. The melanocytes are going to make melanin. So melanin is a pigment granule. It's a molecule. And you can see that these melanocytes, they look weird. They have all these long octopus-like projections, right? These processes will reach up into the upper layers of your epidermis, and they actually donate those melanocytes, they donate the melanin into your cells that are not melanocytes, right? So they actually pigment, or they color your living skin cells in the epidermis with the pigment that they're making, which is pretty cool. So melanin, in your outline, you'll see that there's actually several forms of melanin. There is a very dark kind of melanin, brown-black. There's a reddish melanin. There's a yellowish melanin. And your color of your skin tone, depends on a couple of factors. It depends on what kinds of melanin you're making, right, for your skin. What kinds of melanin are you making? So out of the 3 or 4 different kinds, what ratio are you making, or what are you making? And then what's the amount? And then the third is, are you breaking them down? Is it broken down or not? Okay, so the amount of melanin. But first, let's talk about the melanin itself. Why do we have pigment in our skin? And it's because it's a good UVB blocker. It absorbs UV radiation and it protects your cell's DNA from damage, because UV can break down both your DNA. It can also break down folic acid. So let me just make a quick note here. This is a nice little slide here. So notice all your melanocytes, all the pigment melanin that's in brown, and notice that it's heavily in the bottom stratum basal layer. So the stratum basal, you guys, is only 1 cell layer thick. So it's just the bottom first layer. That's all the stratum basal. And you can see, I don't know what's going on here, but that very first layer of cells is heavily pigmented. So let's just do a quick melanin. So let's discuss UV, because we already discussed how UV is good. So UV radiation is good. Why is it good? Because we need it to make vitamin D. Okay? And vitamin D ultimately helps us absorb calcium. So it's good for lots of things in the body, especially absorbing calcium. But UV radiation is also bad, right? Why is it bad? Because it can do 2 things. It can destroy DNA. Damage DNA. And it can also damage and destroy your folic acid. folic acid is necessary for lots of things, but critically, it's necessary for the nervous system. So I'm going to do nervous system development. Oops, D-E-V-E, development in an embryo. So a pregnant woman really needs folic acid because the nervous system is developing in her body. Damaging DNA is also bad because what this can lead to is cancer. Okay, so melanin is very good for protecting us against UV because UV can damage DNA and it can also damage folic acid. But you also have to be careful because if you think, oh, why isn't everybody super, super dark? Because if UV radiation was just completely bad all the time and there's nothing good about UV radiation, then everybody on the planet would be a very dark-skinned person. They would have a lot of melanin to absorb all the UV because it's 100% bad. But it's not. UV is necessary for vitamin D production, and there's problems that arise with not getting enough vitamin D. One of those is soft bones called rickets. So you do need some vitamin D. You do need some UV to strike your skin, to penetrate your skin, and to activate that process to make vitamin D. So there are all different kinds of skin tones in the world because there's a balance that needs to happen with UV exposure. If you happen to evolve, if your ancestors evolved near the equator, okay, near the equator, where you have 12 hours a day, 12 months out of the year, sunlight that's very sunny. Okay, you have more than enough vitamin D, you have more than enough vitamin D, you have more than enough UV radiation, you're good, right? So you're going to be very dark-skinned, right? You're going to have a lot of melanin develop because you're probably battling too much UV radiation. However, if your ancestors evolved near the poles, so where it's dark for the winter and not so sunny, right? You are going to have light skin because UV radiation in the poles, like if you evolved in Sweden and Norway or these upper areas, you're not worried about getting too much sun. You're worried about not getting enough sun for that vitamin D. So people around the planet, the skin tones that you have is a balance of these two factors, whether you're getting enough UV for making the vitamin or protecting yourself from too much UV. So I hope that makes sense. So this, the diversity of skin color really reflects the diversity of where humans have inhabited the planet. And it's very interesting when you have, now that we have everybody moving everywhere, right? You have very, very dark people living in Norway. And then those people, think about what they're going through in terms of UV. I'm not talking socially or politically, but in terms of UV radiation. If you're dark-skinned and you live in Norway, which is very north, you're going to be in trouble for making vitamin D because your skin itself is blocking UV really well, and then you don't have light. So you're going to want to take vitamin D supplements. Or you can have a diet rich in vitamin D. There's lots of foods that are rich in vitamin D. Then conversely, you can have very light people, like if your ancestors are from Scotland and Ireland and you come to Los Angeles, you're very pale because in where you evolved, you needed all the UV radiation as much as possible. And so you're going to be really at risk for sun damage, right? And UV DNA damage because you don't have the mechanism in place to protect yourself, which is where tanning comes in. So what is tanning? What tells these melanocytes to make melanin? It turns out UV. So these melanocytes are stimulated by UV radiation. So the sun, when it hits the melanocytes are going to get stimulated and they're going to make more melanin. So when you tan, this is basically you're upregulating your melanin. Okay. What helps you, what happens when you lose your tan? So your summer, you're very dark. Winter comes around and your skin becomes lighter. What's happening? Well, it turns out, remember that your melanin pigment is in your skin and your skin is constantly regenerating. I'm saying skin, but I want to say epidermis. Your epidermis is constantly regenerating. So the older cells at the top are going to die and fall off. Maybe these cells had all those melanin pigments. Now they're gone. And the new cells that are made have not seen the sun, right? They're not, it's winter time now, so they're not going to have a lot of melanin. And so it gradually, over a few weeks, you're going to lose your tan because all those cells with that melanin granule will come off your body. So you literally lose your tan to the skin cells all around yourself. Kind of gross, right? All right, so I hope you guys understand that area there. So I kind of went through melanocytes, the second segment of melanocytes. Let's talk about a disorder. So this is albinism. These are different albino animals. You either produce very little or completely no melanin at all. So you're incapable, there's a genetic disorder where you're incapable of making that pigment. So there's no pigmentation anywhere in the body. So the fur or hair on humans and your skin is very pale. Eyes will be red because there's no, the color of your eye is actually melanin as well. So it's red and pink because that's actually the blood vessels. You can see the blood vessel network because there's no pigment to block the blood vessels. Really cool images that I just show you that there's different kinds of albino animals out there. So, other coloration factors. Let's look at this palm. This palm might look a little orangey to you. So this is from a carotene overload. Carotene, I think I misspelled it. C-A-R-T-E-N-E. Sorry about that. So carotene is a pigment that you can find in carrots, like literally it's an orangey yellow pigment, and it can color your skin. That carotene is stored in your skin. So if you have an excess amount of carotene, it actually turns you a little bit orange. Other coloration factors for skin is the blood, just the blood supply. So if you're feeling embarrassed or if you're hot, your skin gets red. That's a color difference. That's because blood is there. Or people who are pale, but they look pinkish, they have a pinkish undertone, that's the blood supply. And another factor is the thickness of their corneum. So I'm actually looking at your outline on letter D under the question, what is the difference between skin darkness and color between people? The bottoms of your feet and the palms of your hand are considered thick skin. And that's because that one layer, the very top layer of your skin is very thick. That makes your skin more pale, at least it looks more pale than the rest of your body, which is why the back of your hand is always darker than the front of your hand, the palm, because your palm has that extra thick stratum corneum. All right, so let's move on from skin color. There's a fun, I'm going to put this video up in your module so you guys can watch this about sunscreen. Just one little thing about sunscreen. So this is what it looks like when you apply the sunscreen. This is what it looks like with a UV camera. So it's really cool how sunscreen is designed to basically act like melanin. So it's super, super dark to UV only. It's not going to be dark on your body. But when this UV radiation comes down and hits your skin with sunscreen on, it's like black paint. It absorbs the UV radiation, protecting your skin from underneath. This sunscreen is different. This is a zinc oxide sunscreen, titanium oxide or zinc oxide. But this is a different kind of sunscreen where it reflects the UV radiation. Okay, so this kind of sunscreen, you'll feel a lot thicker and it looks really white when you put it on your body. These other three sunscreens are the kind that sort of are made to sort of absorb into your skin a little bit more. It doesn't feel as heavy. All right, so let's talk about Merkle cells before we, I need to flip to my Merkle cell picture here. Okay, I don't see it. All right, maybe I took it out. Merkle cells are cells that are in the skin, and they are for touch. And actually, I do know I have a Merkle cell. Here it is. There's my Merkle cell in purple. So the purple cell is a Merkle cell. It is associated with a nerve ending. So this yellow is a nerve ending. This cell is responding to very, very light touch. So the Merkle cells are only going to be found in the palms and soles. It's the hairless areas of your body. They can also respond. They're very sensitive to touch, so they can actually feel the different textures with items. So if you feel a piece of paper versus a piece of sandpaper very lightly, that's the Merkle cells. People who are blind can read those projections of Braille because of these Merkle cells. So they're very sensitive to texture. So I just wanted to point out that Merkle cell for you. Now let's talk about the stratum spinosum. So we just talked about the stratum basale, talked a lot about melanocytes. And remember, this is just the last cell layer, The stratum spinosum is the largest living layer of cells. It's the bulk of your epidermis is stratum spinosum. The reason why it's called spinosum is because you see these little tiny spines between the cells. That appears when you dehydrate the cells for a slide. They're not usually present, but that's why they call it spinosum, because it's spiny. In this layer, you have lots of cells, and you also have this one kind of cell called Langerhans cell. Langerhans cell is a phagocyte. It's your immune cell, and it's present in your skin all the time. So if you get any bacteria that settles into your upper skin layer, these cells can take care of them. Okay, so mentioned that these spines are tight junctions. So all these cells are tied together with tight junctions. That's it for spinosum. Let's move on to stratum granulosum. So stratum granulosum is a thinner layer, as you can see in this diagram. And you can also see why it's called granulosum, maybe, because it's granular. Look at all these little dots that they drew in. What's going on here is that these cells are beginning to die. The next level up is a dead layer. So they're dying, but before they die, they're going to pack themselves full of this keratinohyalin, right here where I underlined. That is a precursor to keratin. So this layer is actively getting ready to pack themselves with keratin. This layer has this area where you have a lot of lipids, and this is going to give the skin a waterproof quality. Okay, so in your notes you have these cells are undergoing apoptosis. So if you don't know what apoptosis is a programmed cell death. Okay, so the cells, the next level up, they're dying, right? So they're going to pack themselves with keratin, and then they're going to very neatly in organized fashion die. And so that's apoptosis. All right, so that's stratum granulosum. You recognize stratum granulosum by it's a thin, dark line like that. Then our next layer is called stratum corneum or stratum lucidum. So this is where it becomes a little bit different. In thick skin only, so if you look at your outline number 4, stratum lucidum is only in thick skin. So let's take a look at this picture. Thick skin and thin skin are different due to 2 things. Thin skin, there is no stratum corneum. Okay, and no stratum lucidum. I'm sorry if that confused you. No stratum lucidum, and the stratum corneum is thin. For thick skin, there is a stratum lucidum, and the stratum corneum is super thick. And that's our big difference between thick skin and thin skin. Where do you find thick skin on the body? two places only, your palms and the soles of your feet. Okay, so let's find the stratum lucidum. The stratum lucidum is right above stratum granulosum. So stratum granulosum is kind of like the one I look for because it's very dark. See the dark line? I'm going to underline the dark line here, right? So that's our stratum granulosum. And then right above that, you have a clear little zone. That's our stratum lucidum. And then you have above that, this is all stratum corneum. So this is our last layer that's completely dead. For thin skin, we see our stratum granulosum, this dark line, right? So I'm going to just draw my pen underneath my dark stratum granulosum. And then above that, I have my stratum corneum, but look how little it is, okay? So there's no lucidum in thin skin. All right, let's take a look at these two. So one of this is thin skin, one of this is thick skin. All right, so let me just do one quick thing for you. This is dermis. Okay, this is a little bit zoomed in. You can see the dermis here, right? This is this underneath the red mark. That's dermis, right? It's pale. Now, this is the epidermis of thin skin. This is the epidermis of thick skin. And where's our layers? Let's review our layers. We know that the very, very bottom, that very first layer of cells, that's called stratum basal. Then we have this really broad living layer called the stratum spinosum, spiny. Then look at this super dark area. That's my stratum granulosum. Then this is a little bit tricky, honestly. There's a slight difference. There's this little bracket that I'm drawing right here is slightly different than the rest of it, right? So this little bracket is the stratum lucidum, and the rest of it is the stratum corneum. Okay. In the thin side, we have our first layer of cells. Just find our first layer of epidermal cells. I might be a little off here. That's my stratum basal. Then here is my stratum corneum. My stratum granulosum, my stratum spinosum. I can barely see a stratum granulosum. It should be here. And then here, this upper part, that's my stratum corneum. Okay, let's wrap up the epidermis real quick. Which of the following helps prevent skin damage by absorbing ultraviolet radiation? Ultraviolet is UV, right? And your answer should be A only. Carotene and keratin. Actually, students get these mixed up sometimes. Carotene is that orange pigment. Keratin is that tough protein that's our outer stratum corneum is made of. So only melanin is designed, or it's able to absorb UV radiation. We can go ahead and answer this. This is a tough one, so pause it to think about it, but I'll tell you the answer. It's letter D. Stem cells persist in both epithelial and connective tissue components of skin. So this is a little bit of a review because connective tissue, you learned in chapter 3, has mesenchymal cells. Mesenchymal cells are stem cells. These are stem cells of connective tissue. So your connective tissue, your dermis, right, can regenerate. Your stem cells are also present in epithelial in the epidermis because that's in the stratum basal. Okay, the other choices don't make sense. So that is your answer. The color of your epidermis is due to a combination of all the following except. So your answer is letter D. Everything else, A, B, and C, do contribute to the color of your skin, but not vitamin D. All right, so we'll pause this section and move on to dermis in part 2.